The Global Fund to fight AIDS, tuberculosis and malaria invests nearly $4 billion a year to accelerate the end of these epidemics and build stronger systems for health. To understand how funds are raised, dispersed and used, we need to look at three different overlapping timelines. Funds are raised in 3-year periods known as replenishment cycles. Those funds are then allocated to eligible countries who apply for funding. Their funding request is reviewed and approved by different global fund structures. This period is called funding cycle. The third cycle is called implementation period and lasts 3 years. During this period, countries will use the funds approved to them to implement their programs. The raising of funds kicks off with a replenishment conference when donors meet to pledge funds. Donors can also pledge before, during or after the conference, as Global Fund's fundraising efforts are ongoing. Following the public pledge announcement, donors sign contribution agreements with the Global Fund. The agreements outline a schedule for payments to be made during the cycle. To efficiently direct donor resources to countries where they will have the biggest impact, the Global Fund allocates funds using a formula that looks at a country's disease burden and economic capacity. Eligible countries are informed of the amount that has been allocated to them after the replenishment conference and are invited to apply for their designated funding during the following 3-year period, which is called the funding cycle. Countries develop funding requests that are reviewed by a panel of technical experts. These funding requests are then transformed into grants that are approved by the board. Grants can be signed at any point during the funding cycle. The timing for signature varies from country to country, and the 3-year implementation period for each country is unique. On average, it takes 8 months from the time a funding request is submitted until the first disbursement of a grant. The lapse of time is used to design grants that will have immediate and strategic impact. As a performance-driven organization, the Global Fund will review a grant's performance on an annual basis and continue to make disbursements for that grant based on proven results. This ensures that the funds are spent optimally. As countries will still have been implementing programs from previous cycles when the new replenishment and funding cycles start, the process gives countries a year between allocation and when their new grants need to be signed. This allows countries to move smoothly from one implementation period to the next without disruption of services. Money that has not been spent by the end of a grant cannot be carried over to the next cycle. Each country starts a funding cycle with a new allocation. The Global Fund continues to work with partners to make cash flows more efficient, reduce transaction times, and increase value for money in order to save more lives and support the global goals of ending the diseases as epidemics by 2030.